For more than 2 years, COVID has impacted every decision in our lives and the life of this nation. And I know you're tired, frustrated, and exhausted. That doesn't even count the close to 1 million people who sit at a dining room table or a kitchen table and look at an empty chair because they lost somebody. But I also know this, because of the progress we've made, because of your resilience and the tools that we have been provided by this Congress, tonight I can say we're moving forward safely back to more normal routines. We've reached a new moment in the fight against COVID-19, where severe cases are down to a level not seen since July of last year. Just a few days ago, the Center for Disease Control and Prevention issued a new mask guidelines. Under the new guidelines, most Americans and most of the country can now go mask-free. And based on projections, more of the country will reach that point across the next couple of weeks. And thanks to the progress we've made in the past year, COVID-19 no longer need control our lives. I know some are talking about living with COVID-19, but tonight I say that we never will just accept living with COVID-19. We'll continue to combat the virus as we do other diseases. And because this virus mutates and spreads, we have to stay on guard. And here are 4 common sense steps as we move forward safely, in my view. First, stay protected with vaccines and treatments. We know how incredibly effective vaccines are. If you're vaccinated and boosted, you have the highest degree of protection. We'll never give up on vaccinating more Americans. Now, I know parents with kids under 5 are eager to see their vaccines authorized for their children. Scientists are working hard to get that done. We'll be ready with plenty of vaccines if and when they do. We're all ready. We are also ready with antiviral treatments. If you get COVID-19, the Pfizer pill reduces your chances of ending up in the hospital by 90%. I've ordered more pills than anyone in the world has. Pfizer is working overtime to get us 1 million pills this month and more than double that next month. And now we're launching the Test to Treat initiative, so people can get tested at a pharmacy, and if they prove positive, receive the antiviral pills on the spot at no cost. Folks, if you're immunocompromised or have some other vulnerability, we have treatments and free high-quality masks. We're leaving no one behind or ignoring anyone's needs as we move forward. On testing, we've made hundreds of millions of tests available, and you can order them for free to your doorstep. And we've already ordered free tests. If you already ordered free tests tonight, I'm announcing you can order another group of tests. Go to covidtest.gov starting next week, and you can get more tests. Second, we must prepare for new variants. Over the past, we've gotten much better at detecting new variants. If necessary, we'll be able to develop new vaccines within 100 days instead of maybe months or years. And if Congress provides the funds we need, we'll have new stockpiles of tests, masks, pills ready if needed. I can't promise a new variant won't come, but I can promise you we'll do everything within our power to be ready if it does. Third, we can end the shutdown of schools and businesses. We have the tools we need. It's time for America to get back to work and fill our great downtowns again with people. People working from home can feel safe and begin to return to their offices. We're doing that here in the federal government. The vast majority of federal workers will once again work in person. Our schools are open. Let's keep it that way. Our kids need to be in school. With 75% of adult Americans fully vaccinated and hospitalizations down by 77%, most Americans can remove their masks and stay in the classroom and move forward safely. We achieved this because we provided free vaccines treatments, tests, and masks. Of course, continuing this costs money, so I'll not surprise you. I'll be back to see you all. And I'm going to soon send a request to Congress. The vast majority of Americans have used these tools and may want again. We may need them again, so I expect Congress, and I hope you'll pass that quickly. Fourth, we'll continue vaccinating the world. We've sent 475 million vaccine doses to 112 countries, more than any nation on earth. We won't stop, because you can't build a wall high enough to keep out a vaccine. The vaccine can stop the spread of these diseases. You know, we've lost so much in COVID-19. Time with one another. The worst of all, the loss of life. Let's use this moment to reset. So stop looking at COVID as a partisan dividing line. See it for what it is, a god-awful disease. Let's stop seeing each other as enemies and start seeing each other for who we are, fellow Americans. Look.